I mean, it was quite many years ago in America that the word geriatrics, because they saw that as people got older, their problems were different. Not only did they have multiple medical problems, they also had psychological, social issues, and so the word geriatric became more for older people who were looked after, specialists who looked after the whole person rather than looking at specialized specialists that looked only at one organ. For example, a chest physician or a heart specialist or a liver specialist. So geriatricians are people who look at the patient as a whole. Now, a lot of things happen when people get older, and actually they talk about the geriatric giants, things like immobility, instability, things like intellectual failure, people having dementias and all that, incontinence, another big geriatric giant. A lot of times the drugs that are given by doctors can cause side effects in older people because the physiology changes as they get older. So that's why the whole new specialty of geriatrics was formed for patients. Initially it was above 65. Like in Malaysia, we still consider above 65, but as people are living longer, for example, in England today, you only can see a geriatrician or a geriatric, go to a geriatric ward if you're above 80, because there are so many old people that only above 80 can go and see them. Even if you're 75, you just see a normal doctor, you don't go and see a geriatrician. Yeah, I mean, it's what they call the graying of the nations. All over the world, people are living longer and longer. 100 years ago, the lifespan was only 45, 50. Now it's gone up to, 75, 80. And countries like, for example, Japan, almost 20% of the population is already above 70s. And a lot of countries all over the world, the percentage of people above 60 is slowly getting higher and higher. And this comes with a lot of not only the problems of medical, but the social issues, psychological, economic. It's very expensive looking after people who are older, who got multiple medical problems, who are no more working, so they're not productive anymore, but they take away a lot of the resources of the country. So very much more the focus should be on healthy aging. WHO actually talks about active aging. That means if you're aging, you should still be very active, and that's very, very important. I think right now in geriatrics, the focus is still a lot on treatment and disease, management and all that. But we should change that and look more at healthy aging, as people in their 60s, 70s, 80s should be still very active, should be still productive, should be still working for, if you ask me, because they can, So I think that's where the focus should be, more towards preventive and healthy aging rather than just focus on treatment and disease. So if you're looking at focusing on preventive medicine, I think lifestyle is the key issue. We should teach people that even when they are older, exercise, having good nutrition, staying away from toxins, having good sleep, managing your stress, good attitudes, social interaction, very important. They find that people who are lonely get sick faster, get more disease, get more depressed. So social interaction is very important. Having some sort of purpose, knowing why you get up in the morning, so that you're excited about life, and that's what I find that a lot of older people, they lose their zest for life. And when they lose their zest for life, everything comes down from mental problems to physical problems. So I think a lot to be focused on lifestyle and get older people to interact back into the society and keep themselves very active. So I think again, a lot depends on how the society looks at it. For example, if you look at the blue zones, the 5 areas in the world that Dan Butler actually coined the word, the Okinawans, the Adventists, the Nicoya, Sardinians, and I think there's one more in Corsica. The 5 areas in the world that are called the blue zones. Now, Dan Butler has studied them, and he replicated that whole thing in some of the towns in America itself. Actually, it's a show on Netflix, living up to 100, where it actually tells you these are the things you can do that will help to live longer, be healthy, and it's got a whole list of things that you can do, from what we talked earlier, purpose, to social interaction, to physical activity, managing your stress, exercise and all that. In fact, Singapore is now considered could be the next blue zone, because the government has taken a lot of this and trying to cultivate that in their population in Singapore. So I think looking at that, we should study that and follow what they're doing, and I think that will be very good, because people in the blue zones, very few of them have chronic disease. A lot of them live to a very good healthy age of 80, 90, 100. And I think this is something that we should try to follow and do if we can.